Good day, everyone. My name is Dr. Gamafoy. Welcome to this channel. Today we are going to discuss about trisomy syndrome, which is trisomy 21, popularly known as Down syndrome. So, this syndrome is among other types of trisomy 21, the others being the Patau syndrome, which is trisomy 13, the Edwards syndrome, which is the trisomy 18. But among all of them, this Down syndrome is the most common type of trisomy. Is in fact is even among the most common chromosomal abnormalities, if not the most common ones. Why? Because almost all the other chromosomal abnormalities like trisomy 13 or trisomy 18, in most cases the pregnancy will have been miscarried even before delivery, because the higher you go, for example, trisomy 13 is more liable to get miscarried than trisomy 18, and then trisomy 18 is more uh, risk to miscarriage than trisomy 21. As we are going up, the chance of getting to delivery period or to getting to delivery time, the chances is increasing. So that means Down syndrome or Patau syndrome is less common than Edwards syndrome, and Edwards syndrome is less common than Down syndrome. So that is it. So this is a clinical scenario, but we can't appreciate it more until we explore about Down syndrome. So we are coming back to it. So this is the World Down Syndrome Day, which is initiated by United Nations in 2011, and this day is March 21st. So in each March 21st of each and every year, there is an creation of a public awareness and some measures to be taken in order to prevent this Down syndrome. This is it, March 21st. So this is very important, especially for MCQs, public health MCQs, community medicine is very, very, very important to know the day. That's it. So Down syndrome account about 10% of all diseases that are causing mental retardation in children. So if you can get 100 children that are suffering from mental retardation, so about 10 of them will be due to Down syndrome alone. So this is showing, and you can remember there are thousands of diseases out there that are causing mental retardation, but Down syndrome alone account for 10% of all diseases. So that is why it is even, you can say, the most common genetic disorder that lead to this mental retardation. So that is it. So about half of the children that are born with Down syndrome have what? Severe heart disease. So that means 50%. Not all the children born with Down syndrome, but 50% have severe heart disease. For example, tetralogy of Fallot, um, VSD, which is the ventricular septal defect. While about 15% of the babies die in the first year of life. So they didn't reach up to first year of life. But those that go beyond their fifth year of age, that is beyond their fifth birthday, those children actually have more tendency to live longer, as long as like 50 years or even more. So that is it. So the characteristics of this Down syndrome, there are 4 characteristics of this Down syndrome. We have mental retardation, stupid appearance, delayed development, especially delayed motor development, like crawling, walking, speech. So that is it. And then multiple malformations. As we have already said, there is malformation in the heart and many other organs, as we are going to see in a minute. So this is the set chromosome in each and every one of us. This is supposed to be the first chromosome, the first set, because we are having 23, including the sex chromosomes. We are having 23 sets of chromosomes. So the first set, we're supposed to have 2 chromosomes. The second set, we're supposed to have 2 chromosomes also. For the third set, we are supposed to have 2 chromosomes. Fourth, fifth, up to 23, we're supposed to have two set of chromosomes in each set. But in trisomy 21, look at it, they have 21 they have 3 chromosomes instead of 2 in the 21st set of the chromosomes. But in Patau, you will see 3 like this. Coming in Patau, it is this that we are going to see 3 chromosomes, not in 21. But in 21, this is because we are talking about 21, so that's why you see 3 chromosomes in the 21st set of the chromosomes. So there are many factors that serve as risk factors for the development of this Down syndrome. Number one being increasing maternal age. So that means a woman that is 30 years of age is at less risk. She's having less risk or lesser risk when compared to the one that is 34, 35. So the more the increase in age, the more chance of a woman giving birth to Down syndrome child. So that is it. So, but in most cases, the cases occur beyond 35 years of age. But I didn't say, oh, that didn't mean that a woman less than 35 years can't give birth to someone who is having Down syndrome. So other risk factors, we have X-ray, because that's why even X-ray, until necessary or the benefit outweigh the risks, X-ray, CT scan, all are contraindicated in pregnancy because there are some kind of dose or there are some kind of exposure that will damage the DNA of that particular baby. So that is it. Because that baby now, the cells of the baby is rapidly growing and replicating. So that X-ray or the radiation can actually harm the DNA and can cause these aberrant or aberrations in the chromosomes. That's why ultrasounds can stay by far the most important and safer or the safest among all the kind of investigations or images in pregnancy. So drugs like anti-epileptic drugs, anti-metabolism, as anti-metabolite, for example, like antipolic acid, right? Like methotrexate is also harmful. Toxicity, that's toxins. Virus infection like herpes simplex virus, measles, Epstein-Barr virus, and mumps. So, and can also be inherited. Yes, that's why there are some believe that the Down syndrome can be inherited as an autosomal uh, disorder. So that's why it can be passed from parent to children. So that is it. So this is a clinical manifestation: mental retardation, stupid appearance. So now we are going to see the mental retardation. Usually, the patient with Down syndrome has an IQ of 35 to 70, but some may have near to normal IQ, but usually they have the IQ ranges between 35 to 70, and this mental retardation become more obvious with aging. So this is a stupid appearance. So the stupid appearance, we have the brachycephaly. What is brachycephaly? Brachycephaly means there is a shortening of the anterior posterior diameter of the head or anterior posterior length of the head, but there is widening of the biparietal diameter. That is to say, from front to back, there is shortening of this diameter, but there is increase in the uh, distance between the biparietal, that's between the two parietal. So we have the epicanthial fold, which is seen in the ear. I will show an image in the next. Okay. So this is a stupid appearance. So this is these are the features. So we have the obscurantum palpebral features, as we are seeing it here. Sorry. Yes, here we have the low set ears, and sometimes they are folded. Sometimes the ears are normal, and short neck, and in some cases the neck is having a lot of skin, so excessive skin deposition in the neck area. So this is the brush filled spot. So this is in the iris. So flattened nasal bridge. So this is the nasal bridge is flattened. So that is it. Epicantial fold. Yeah, it is. So that is it. So this is the picture of uh, uh, features of Down syndrome. So now this is the stupid appearance. See the face. This girl looks stupid, right? This boy looks stupid also. So this is stupid appearance. So all these features, they are the one that uh, make them to look stupid. Open mouth. The mouth now is open and protruded tongue. So brush field spot, we have seen it. And then big anterior fontanelle and delayed closure. Uh, Anterior fontanelle used to close. Some textbooks they will say 9 to 18 months, while some textbooks used to say 7 to 18 months. So in either the case, in this Down syndrome, in most cases or in some cases, the anterior fontanelle used to remain patent even beyond the 18 months of life. So that is it. So this is it. This is another. This is a Down syndrome baby. See, he looks stupid, right? So, but this his neck seems to be normal. That's why some features are not constant features. This is also a Down syndrome. See the neck, excessive skin in the neck area. So this is Down syndrome. This is Down syndrome patient. See them again. This is all family having, all friends having Down syndrome. So there are another category of features. We have the physical development retardation. That's the physical development. We have the delayed motor development. They will have delay uh, time in started crawling, sitting, because the babies are supposed to start crawling about 7 months of age. But in Down syndrome, there will be delay. Maybe they won't start the crawling until later in life, maybe 9 months or 10 months. So that delay, right? Delayed teeth eruption, lower muscle tension. They call it hypotonia, floppy child. There are several causes of floppiness in a child to have low muscle tension. So Down syndrome is among the causes. Like other causes like hypothyroidism, like Wadenick-Hoffmann disease. There are so many diseases that are causing floppiness in child. Short fingers, definitely. Short broad hands, incurved and short pipped the pipped fingers. The pipped finger or the pipped digit used to be short and incurved. Extra space between the first and the second toe, and then hyperflexibility of joint. This hyperflexibility of joint is not specific to Down syndrome. There are other syndromes that are causing hyperflexibility of the joint. For example, Ehlers-Danlos syndrome, Marfan syndrome. Ehlers-Danlos syndrome, like mutation in gene called COL, COL 5A gene, COL 4A gene. So collagen, deals with collagen synthesis. While Marfan syndrome is a mutation in the amino or on the gene that is synthesizing the fibrillin, right? Fibrillin. So that is it. So this is it. So see the digit. They are very, very short digit. So this is Simeon Chris. All of us that are non-Down syndromic, we are having another line here like this. But in Down syndrome, they are only having this single one. So this is called Simeon Chris. At least there's a space between, extra space between the first and the second two. So that's it. So we have problems that are associated with Down syndrome, DS. Congenital heart disease that account about 50%, as I have said earlier in this case. Malformation of gastrointestinal tract, for example, duodenal atresia. You know, during development of a child in the womb, so each canal you are seeing that we're having, like intestine, like stomach, uh, like trachea, any tubular organ in our body, before it is not tubular. It is used to be created non-tubular. It is later during the development inside the womb, that is intrauterine life, it is going to be recanalized. So the cells that are in now will going to undergo apoptosis. Now they are going to die. So now it will form a kind of hollow tubular organ. But in Down syndrome, there is failure of that recanalization. So it will still remain blunt, so and clogged and distorted, right? So in that case, that is why many Down syndrome cases are associated with polyhydramnios, excessive amount of amniotic fluid, because amniotic fluid is supposed to be swallowed by the baby. But in this case, even if if the baby swallow the amniotic fluid, he cannot swallow a lot because the channel is blocked, especially the upper GI tract is blocked due to this duodenal atresia. So we have this Hirschsprung disease. Hirschsprung disease is loss of or absence, complete absence of uh, ganglions that deals with motility of the GI, of the rectal area. So that's called aganglionic. So in this case, the patient with Hirschsprung disease will now can't pass meconium. So they will have failure to pass the meconium, and because the meconium is the first stool of a baby, right? So because the meconium retain in their stomach, now the stomach will be distended, right? So distension of their abdomen, and then there's failure to pass meconium. And another, we have hypothyroidism and leukemia, which is account for 10 to 30 times in normal individual, because hypothyroidism can occur in normal individual like me, like you, but in Down syndrome is 10 to 30 times than in normal children. So obesity later in life, they are at risk of developing obesity. So that means they are at risk of developing metabolic disorders like diabetes mellitus, acute myelogenous leukemia, immune dysfunction. So that's why they have risk of developing frequent infections because of low immunity. Women with Down syndrome are usually fertile and can become pregnant, but almost all the males with Down syndrome are infertile because there is distortion of this spermatogenesis. So for diagnosis, there is prenatal screening, and even if you didn't do any screening, there are features. We see the stupid features, mental retardation. So this can make you to suspect Down syndrome in a child, and can be confirmed only with karyotype. Like cancer, you can't diagnose cancer. You say definitely this is cancer until you do biopsy. So in Down syndrome, you can only confirm it with karyotype, not with. You can't rely on only the stupid appearance, the mental retardation. So, and there we have different patterns of Down syndrome. We have the about 95% is caused by non-disjunction. Yes, but while about 4% is caused by translocation. 95% non-disjunction during meiosis. This occur during meiosis. So during mitosis. So this about 4% of the extra copies occur due to Robertsonian translocation, in which there is translocation between chromosome 14 and chromosome 21. Some segment of chromosome 14 will now going to be attached to chromosome 21. So this is, and then the 1% or less than 1% is mosaicism. When we say mosaicism, is some cells will be having the 3 set of 21 chromosome or 21st chromosomes, while some cells will be normal, having the 21st chromosomes just 2, like normal. So some cells are normal without having those trisomies of 21st chromosomes, 21st set of chromosomes, and some cells are having that abnormality. That's the mosaicism. So that is it. So that is it. So in this, see it, it's having trisomy like this. So this is another this is called karyotype. So here it is 3 chromosomes, but all the other chromosomes are having 2 set. Maternal serum screening. So a woman who is older than 35 years or older is supposed to undergo a kind of test called amniocentesis or chorionic villus sampling. So about 30% of trisomies can be detected via this amniocentesis or chorionic villus sampling. So there are some markers called alpha fetoprotein, estriol, and HCG. There's another one that I didn't put, which is called inhibin A, which is called quadruple screening, making them 4: alpha fetoprotein, SA, estriol, human chorionic gonadotropin, and inhibin. So in Down syndrome, the inhibin and the HCG remain elevated. So just remember, there is elevation of the HCG and then the inhibin.
So HI, right? So that is it. So ultrasound also can help us to diagnose Down syndrome. This all these are occurring in, you can do it in intrauterine life before delivery. So let us see the ultrasound. There is something called nuchal translucency. The dark area in the ultrasound. This is the back of the baby. So this is the, because this area is a bit dark. It's darker, right? It's not echogenic. It's anechoic or it's hypoechoic. So this the distance between here to here. I'm coming. The distance between here. Sorry. The distance between here to here is supposed not to exceed 3.5 millimeters. Some textbooks say it's 3, but in this case, you see it's 4, right? So this is called as increase in uh, nuchal translucency. So this is it. Chorionic villus sampling done at 10 to 12 weeks of gestation. Early amniocentesis, 12 to 15 weeks. Second trimester amniocentesis, 15 to 20 weeks. So this is it. So this is the amniocentesis. A needle will going to be amniotic fluid will going to be withdrawn. Why amniotic fluid? Because the cells of the baby, the skin cells of the baby are going to shed in the amniotic fluid. So those cells from the baby that are shed inside the fluid are going to be collected and then cultured and then review their chromosomes. If you see chromosome 21, then chromosome 21 having 3 set of chromosomes, then Down syndrome can be suspected. This is chorionic villus sampling from the placenta. Because why the chorionic villus? Because the placenta is made up of which tissues? Trophoblastic cells, right? So you are going to collect the placental cells and then culture them also. You will see this karyotype, and then do karyotype, then you will see this chromosome 21 having 3. So that is it. Women that are under 35 years, then in age, they're supposed to have uh, chorionic venous sampling or second trimester amniocentesis. While those that are younger than 35, like 34, 32, but still they're at 30 something, so now they are going to have maternal serum screening at 15 to 18 weeks gestation. So thank you very much. Thank you for visiting the channel. Please, if you find this video helpful, like, comment, share, and subscribe to the channel. Please, for support. Thank you very much.